Hi everyone, welcome to Doc Simple. I'm Doc Leo.
I'm Doc Ben. Today's episode, minor head injuries.
So let's get into some of the symptoms that we'd be concerned about with head injuries. We want to find out when these symptoms are minor and when they're severe. So symptoms that we expect with head injuries, Ben.
Okay, for minor head injuries, the symptoms that we are not particularly concerned about. Headache, dizziness, lightheadedness, nausea, maybe a little vomiting, fatigue, maybe a little forgetfulness, some visual disturbance, little bit, and a little sleep disruption.
Okay.
Again, all of what I just said is in minor form.
And what we would expect for someone who's had a head injury that happened from, let's say, a slip and fall and a bump on the head. Or, when you're standing up from a cabinet and you hit your head on top of the filing cabinet or something along those lines. We tend to see quite a few of these in the emergency room. These are common visits because of fear and concern that something more significant is going on from the head injury itself.
Right. So a fall down a couple steps or even a minor car crash.
Right. And so the focus of what we want to point out is that there's a level of expectations with the symptoms that we just described, which we consider to be normal with these minor head injuries.
That's right. So keeping that in mind, let's talk about the treatment of minor head injuries.
Sure, yeah. So the first part of treatment is using some over-the-counter medications like acetaminophen and ibuprofen for control of the headaches that you might feel.
Right.
And then staying hydrated. Anything else you can think of?
That's right. So now that you've kind of bruised your brain a little bit, of course, rest and decrease eye strain would be recommended. Now, importantly, until recently, it was a hard stop, no physical activity, no eye strain. The recommendations have loosened a bit, and you basically will do those to the point of symptoms. Okay? Sounds good? Reasonable? Okay. Let's talk about expectations and prognosis.
Yeah, how long should someone expect to have symptoms?
Of course, depending on your level of health, how much you're able to rest, and how significant the injury was, you're talking anywhere from a couple days to even a few weeks.
Yeah. At times, these symptoms can actually last significantly longer, especially for people who have had concussions in the past. Now, what would happen if your symptoms are more severe?
Okay, so I think let's talk about who to call and where to go to answer that question.
Perfect, let's do that.
The good news is this is pretty easy and straightforward. You pretty much have your group that can kind of stay at home and manage the stuff at home or the emergency room. I would suspect most doctors are not going to argue with the comment that doctors' offices, urgent cares, immediate cares are not really equipped to handle head injuries because the concern would be due to a CAT scan or not.
Correct.
So if the symptoms we listed are in fact minor, you can generally function. Home therapy is just fine.
Perfect.
If any of the symptoms we mentioned raise to a level of concern or are severe, significant, or persistent,
right,
then an emergency room trip is your best bet.
One of the concerns would be if you're on a blood thinning medication. Others would be
symptoms like projectile vomiting, or you can't wake someone up, or your arm or your leg doesn't work, or you can't speak properly, or you forget your dog's name.
So if any of those symptoms come up, I feel like the dynamics are that you just have to come to the emergency room because you'll likely need a CAT scan. Those symptoms are severe enough where we would be concerned to go ahead and do a CAT scan when we see you.
That's right. I just want to make one comment about CAT scans, though, just for you to understand. CAT scan purposes are to uncover a broken skull or fractured skull or bleeding in the brain. It is not for the purpose of diagnosing a concussion. Would you agree with that?
I would. In fact, we don't really have a tool to diagnose concussion at all. And we tend to lean on symptoms and say if you've had a head injury and you have some symptoms that we've discussed, that we are concerned about a concussion and we're going to prophylactically treat you for a concussion with the approach that we just discussed.
Okay. I think that covers minor head injuries.
All right.
Yeah.
Thanks for joining us on Doc Simple.
I'm Doc Ben.
And I'm Doc Leo. Please like us and share us.